Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 6 Homeopathic Remedies for Lupus. Full name is S.L.E. Systemic Lupus Erythematosus. What is lupus or systemic lupus erythematosus? Mind it, throughout the video I will use this term lupus, S.L.E or S.L.E interchangeably. That is, all have the same meaning, the same disease. Lupus, systemic lupus erythematosus, S.L.E or S.L.E are all same thing. In Latin, lupus means wolf. The wolf has got face resembling the chief signs of the disease in human. Lupus, to be precise, presents a group of diseases of which systemic lupus erythematosus is the commonest and severest. Elsewhere, I will give the other types of lupus. S.L.E is a chronic autoimmune disease. Mind, it is an autoimmune disease. In modern allopathic medicine, it is incurable. They administer steroid-like remedy lifelong to keep it under control. They means the allopathic doctors. But since homeopathy is based on treating constitutional dyscrasia, cure is not impossible here, but of course challenging, not in the grip of ordinary physicians. Only the experts, knowing the intricacies of homeopathic constitutional treatment, can treat such disease. If we break the full name of the disease, we understand it is not a local disease, rather a systemic disease affecting multiple organs like skin, joint, kidney, blood cell, brain, heart, lung. Lupus means inflammation and erythematosus means swollen and reddened. Again, autoimmune disease means where the immune cell of the subject are the culprits. So S.L.E is a slow but steadily developing disease that affects the quality of the life most adversely. Most adversely, because at the time pass by, the patient will be in the grip of the disease more and more. Please remember, many take lupus as a skin disease, but it is not so. Lupus is a complex systemic disease. The primary symptom of lupus is this. On the face, a butterfly-like symptoms, skin rashes appears. It is just the preliminary symptoms, or rather one particular symptom on the skin. Later we will be seeing how many systems does this disease attack. What are different types of lupus? Discoid lupus. Discoid lupus means lupus of the hand. Neonatal lupus. Neonatal means newborn babies. Drug-induced lupus, isoniazid, hydralgin, procainamide, quinidine, minocycline. These medicines can induce type of lupus. That lupus I have not seen any image. S.L.E is the commonest. This is the S.L.E and the commonest. Now see what are the organs affected. This shown here is small. The first one is seeing is here pleural effusion. That is, it will attack lung. Heart problem. Heart can be affected. Lupus nephritis. Kidney can be affected. Arthritis. Joint can be infected or inflamed. Raynaud's phenomena. Fingertips. Fingers. There are so many systems are affected by this lupus. So it is a systemic disease. What are the signs symptoms of S.L.E? Reddish swollen rash on cheek. Primary symptoms. Forehead, around nose, popularly known as butterfly rash. This is called telltale symptoms of S.L.E. Telltale symptom means the most descriptive symptom and most common symptom. Burning, itching in rashes and blisters in other parts. Joint pain, kidney, heart, liver, brain affections. Hair fall, drying of hair. Nail damage, fever, anemia, subcutaneous hemorrhage. That is hemorrhage beneath the skin. How lupus is diagnosed? Lupus is systemic autoimmune disease affecting various organs of the body. No singular test can confirm lupus except ANA test. And it will come in anti-nuclear body test actually, but multiple tests are required. Complete blood count, first number one pathological test required, complete blood count. This may give low Ag%, low WBC count, low platelet count are noted in lupus and other ailments also. So in lupus it will be there, but it is not the diagnostic symptom of lupus because it can be there in many other diseases also. It can also show how well the kidneys, liver are functioning, that is from blood count. Liver, kidney cells and liver cells, how they are functioning can be known also. In case of lupus, certainly there will be damage of these two type of viscera, that is liver and kidney. ESR, erythrocyte sedimentation rate. Elevated value is found in lupus and other ailments. Urine analysis, presence of protein and RBC are found in lupus and other ailments. Chest X-ray can show inflammation of lungs. Echocardiogram can show heart problem. Biopsy, FNAC, fine needle aspiration cytology of kidney and skin biopsy may show changes indicating lupus. Anti-nuclear antibody test. Possibly this is the most important test which singularly can show the person is suffering from lupus, because here the test is confirming autoimmune activity in the body, but lupus rheumatoid arthritis may also positivity. Further special tests are done to pinpoint the diagnosis. Since this is antibody, anti-nuclear antibody relating to lupus, so this type of antibody comes when lupus is there. But there are other one or two diseases, namely rheumatoid arthritis, it can also be seen. So further specific test for antibody must be there to confirm that yes, it is lupus. Is lupus a contagious or hereditary disease? Lupus is neither a contagious nor a hereditary disease. Who are predisposed to lupus? Women, 9 times more than men, and aged between 20 to 45 years. What is the relation between cervical cancer and lupus? Medical professional having studied Sweden's National Patient Registry, Swedish National Cervical Screening Biopsy and Swedish Cancer Registry established few years back that there did exist a link between lupus and cervical cancer. Cervical means actually cervix of the uterus. This is uterine cervical cancer. Results from studies show that women with S.L.E have twice the risk in developing cervical dysplasia and even invasive cervical cancer. First point. That is, who are suffering from lupus, they have the risk for attacking double than normal. Those who are undergoing immunosuppression medication, for some reason, immunosuppression medicine, have the highest risk. Age, sex, evaluation of healthcare, marital status, history, education, number of children, cancer screening were all taken corresponding consideration during the study. Before study, all these several factors were considered. My own perception about the above observation. This observation I can certainly draw a remark, a decision or a rather conclusion from this fact. What conclusion? We all know cancer seldom attack a person unless immune system is either weak or distorted. I think immunosuppression medication in many cases damage the immune system of a subject. S.L.E itself autoimmune disease which transfers that immune system of the subject is already perverted. Over and above, if immunosuppressant medication is applied, the same is like adding salt to the injury or other wounds. So the propensity of being attacked with cancer is further increased. So S.L.E patient must not get immunosuppressive or immunosuppressant drugs. Then the cancer chance will be more and more. Now the remedies. Arsenicum iodine for lupus. Edema from eyes, intense photophobia, eyelids edematous, falling of lashes, scrofulous ophthalmia. Gingivitis. Gingivitis means gums inflammation. Apathy in mouth, ulcers. Apathy means ulcers. Tongue, burning, trembling, stiff. Gastralgia. Gastralgia is inflammation of the inner lining of the gastric mucosa, that is stomach, from slightest food or drinks. Asthma with severe dyspnea, scanty frothy discharge, burning or coldness in chest, psoriasis. Several systems are attacked. Staphylococcus lupus, falling of hair from occiput and around ears, dandruff, recurrent styes in eyelids, iritis, blepharitis, prosopalgia. Blepharitis is actually inflammation of the eyelids. Iritis is inflammation of the iris. Prosopalgia is an inflammation of cranial nerve called, in the facial, in the face, there is cranial nerve. The inflammation of that cranial nerve is called prosopalgia. The disease other names are tic douloureux or suicide disease. The disease is so painful that a lot of patients committed suicide in earlier days. Since there was no painkiller in that time, the patient used to go into suicide for the pain of this prosopalgia, this trigeminal nerve neuralgia. This occurs in the pain generally, in the face. Pain starts from lip, then spread all over the face. Dental fistula, thrush, stomatitis, pyorrhea. Pyorrhea, dental, there is inflammation of the gums. Stomatitis is inflammation of the mouth, buccal mucosa, the mucous membrane within the mouth, that is cheeks, gums, gingivitis, that is inflammation of this gum. Everything, stomatitis means anything within the mouth. Buttock ache while sitting, arthritic nodes on finger joints. See this arthritic node in the finger joints, how it looks like. Causticum lupus, trembling, convulsion, chorea, worse during menses, jerking, twitching, startling. All these symptoms shows that the patient's central nervous system is affected. Restlessness, legs are constantly moving at night, disposition to stretch, bend and crack joints, drooping or paralysis of eyelids. Prosopalgia, better from cold water, gum, spongy, receding. Tongue red in middle, sides coated. Chest tight, sore, base seems tight, short breath before coughing. There is so many systems are being in trouble because it is the nature of lupus. Sepia for lupus. Fits of vertigo. Worse in open air. Least movement of arms. That is from least movement of arms and in open air worse. Vertigo worse. Hair falls out after chronic headache. Drooping eyelids. Black spots, sparks, flashes. Zigzag sticks of light in front of eyes. That is in vision. In the vision field, these are things. Severe aversion to smell of cooking foods. Post-nasal dropping of heavy, lumpy discharge must be hawked out from mouth. Whooping cough that drags on. Sinking feeling in epigastrium. No amylation from food. Burning feeling in the pit of stomach. Nocturnal enuresis. Urine thick, foul, white, gritty, feeble. Cutting pain in bladder before urination. Rectum constricted and powerless. Constant oozing. Pain shoot up in rectum. Tuberculinum for lupus. Meningitis in squint. Deep, violent head pains. Shooting pain from over right eye through the head to the left ear. That is diagonal from right eye to left ear. Scalp sensitive. Aching in malar bone. Asthma, pneumonia with profuse thick yellow discharge. Sensation of fatigue in limbs. Limb feel weak as if paralyzed. Acute articular rheumatism. Salicia for lupus. Convulsion of epilepsy. Aura starts in the solar plexus, creeping into the chest and stomach. Pustular keratitis. Hypopian. This is hypopian. Hypopian means in the anterior chamber of eye, accumulation of inflammatory fluid. This is the hypopian. Opacity in the cornea. The cornea is opaque. Opacity, psychotic asthma, pleurisy in epigastrium, ascites with gait effusion, rheumatism, soles, cannot walk, cramps of calves and soles. Now emphysema. Now what is emphysema? This is the emphysema. Pleura, this alveoli in the emphysema, this is normal alveoli. In case of emphysema, all the alveoli structures are destroyed, and the alveoli are always in the state of expanded. It cannot contract. Usually, this healthy alveoli contract, expand, contract, expand. This is always in the expanded state, because that particular elasticity is lost due to infection, due to disease. And in that case, the lung field in X-ray looks like this, whole totally black, totally black. This is the telltale X-ray of emphysema. In another disease, you can see this whole blackness of the both lungs actually. So, yes, with this we complete. This finishes. Actually, in description there is some trouble. I feel a lot of trouble, because since lupus is systemic disease and each medicine covers a lot of symptoms, I have to may have missed with this description of symptoms. Please mind it. Don't mind it, please.